Dr. Himabindu, I think, is traveling, right? So she
Yeah,
may
yeah,
not be able to connect fully. That's what I understood.
कुछ नहीं मैडम बस है ना
I'll just check with Dr. Ali once. Yeah, give me a minute.
होस्ट कौन है होस्ट वो स्किट का वीडियो और वो सॉन्ग प्ले करने के लिए होस्ट को इज हैविंग द वीडियोस
आईबी मेंबर होगा ना
विवेक आर यू हैविंग इट
No, sir, I don't have it, sir. I'm hosting this, but I don't have it.
Oh, then you should have it కదా ఎందుకోసం అంటే you'll be playing the skit video also and
I think Samir Shah sir holds it, sir. Let me check with the sir.
just find out and keep it ready.
एंड डू यू हैव द क्विज रिजल्ट्स डॉक्टर सुरेश वैसे डॉक्टर समीर के पास ही है वो
समीर सर बोल रहे थे कि करेंगे
वो कह रहे थे चलो ठीक है फाइन
एक ही चीज है कि next we should focus on the physical activities.
Yes, Dr. Shisalam. We'll have a core group meeting soon. कि क्या कर सकते हैं next physical
Yeah.
को और वो करने के लिए. I think okay, I was just trying to see if our youth champion is here.
And Dr. Srisalam, do
Yes.
you have any idea about Samira? What is she doing?
She's from the UNICEF. Huh?
No, Samira is not from UNICEF, Dr. Shisalam. She's from KL University, from what I understand. There is a group on KL University, Safe Life Champions. And I think Samira is a part of the KL University Safe Life Champion.
Okay, fine.
Which university? Sorry, Dr. Salima.
KL University, KL University.
And the other girl who is the champion, that is from UNICEF?
She's not from UNICEF, but she's a youth champion who has been identified from UNICEF, of course.
Right. Okay, and fine.
So Shubhangini Thakur is the youth champion. Is Dr.
Yes, Dr.
Shubhangini?
Salima.
Yeah, hi
Yeah.
Shubhangini, how are you?
Hi. Yeah, it's just Dr. Shubhangi, not Guinea. So just
Okay, Shubhangi. My apologies.
Yeah.
And where are you? I mean, working. Can you just say a little bit about yourself, Dr. Shubhangi?
yes. I am a dentist by academic training, and right now I'm a public health researcher. So you can just introduce me as a public health researcher and youth advocate from UNICEF with academic training in dentistry. Yeah.
That's nice.
Good afternoon,
And-
Dr. Ali.
Hi, good afternoon. Hi, good afternoon.
Good afternoon, Dr. Ali.
Hi, madam, good afternoon.
Welcome.
Dr.
So
Ali,
I
Dr.
think-
Aditya is also here, and of course, everybody from IAP, Dr. Arya, and the whole team is here.
Thank you, sir, for joining. Let me
Namaskar.
just call to my
Right,
youth
sir.
colleagues
Namaskar.
for joining.
Namaskar.
Namaste, sir, namaste.
Namaste.
Good afternoon to all. Thank you for
Welcome, Jalil sir.
Good
Welcome, Ahmed sir.
madam. Good
Namaskar,
afternoon,
sir.
madam.
Namaskar.
Kuturu, good afternoon.
Good afternoon. Vanakkam, sir. Vanakkam.
Very
Vanakkam.
colorful and divine look.
I just know I came from a temple.
Srisalam is always looking younger, sir.
Very good.
He's one of our panelists, Dr. Chakrapani, EB from the Telangana.
Good morning, good afternoon.
Namaste.
Oh, Dr.
Chakrapani.
Chakrapani, Mavi. Welcome, welcome.
Any help and any work in Telangana, you should just speak to Dr. Chakrapani. He'll get it done.
Oh,
With the help of Srisalam.
नमस्ते
Welcome, madam.
मैडम
Dr.
बिंदु मैडम
Madam.
नमस्कार
Madam joined.
मैडम तो कार में जा आ रही हैं बिजी हैं
Unmute,
Hi,
madam.
Dr. Himabindu, how are you?
Unmute.
Kema madam traveling. Eh?
Good afternoon, sir. Good afternoon, sir.
Good afternoon, madam. Traveling, madam.
Hi, madam. Good afternoon.
Dr. Himabindu madam is always on wheels.
मैम आपकी वॉइस थोड़ी डिस्टरबेंस में आ रही है.
हाँ हम ट्रैवल कर रहे सिग्नल
Oh, maybe because fine.
मोबाइल में चल रहा क्या
We have 1 more minute. We have 1 more minute to start.
सेफ जोन में आके मैडम आप गाड़ी रोक लेना जहां आपकी आवाज आने लगे.
आ जाएगी हाँ.
कल भी बहुत अच्छा एक्टिविटी किया था हम लोगों ने. सेंट्रल एएचए में एडोलेसेंट गायनेकोलॉजी के ऊपर वेबिनार था सर हम लोगों का. एंड
Oh,
काफी
great.
अच्छा रहा उसको.
Am I audible now?
नमस्कार. आप भी यात्रा.
Yeah.
Yeah.
Good evening. Good evening. all. So good afternoon all. Arya sir.
या मैडम
Aditya is
4 बज गए मैडम. स्टार्ट करें.
हाँ.
Go ahead, sir. Go ahead.
Good afternoon. I welcome all the esteemed dignitaries from CIFP, CAHA, EBs from various zones, esteemed senior members, panelists, least but not least the youth ambassadors, and our invited guests, Dr. Adit Mahapatra, Dr. Saeed Hubli Ali sir, and Dr. Vasant Kalatkar sir. Now I invite Dr. Hima Bindu Madam, our Silver Jubilee Chairperson, for opening remarks. Hima Bindu.
Very good evening. Good afternoon to all. Thank you, Dr. Arya, for starting the meeting. Am I audible?
Yeah, madam.
I hope there's no reason. Hello, sir.
Yeah.
Yeah. So very good afternoon. This is another wave 18 of our April 18th, and this is our unique flagship program of Adolescent Health Academy in the Silver Jubilee year. This is just we have conceived this idea that we should get youth in our forefront in all our discussions, and we have successfully conducted our team of AHA Youth Forum and the Wave 18 team headed by Dr. Sri Sailam, Dr. Samir Shah, Dr. Sunita Manchandana, many others, Dr. Sangeeta Luda, all of them are really congratulating them that this to this level, and with more efforts will really create a Sir, I think disconnect हो गया.
Disconnect हो गया.
Yes.
And what you can do is you can disconnect your video and just speak audio.
Yeah.
You can keep the audio. Hima Bindu madam, you can just switch off the video and just keep the audio.
Good afternoon, Sugandha sir.
I think okay, then I think we can hand over to Dr. Sunita madam.
हाँ सुनीता
To
मैडम
further
आप
proceed.
स्टार्ट कर. आप कर रहे हैं.
Yeah, good afternoon, everyone.
Yeah.
Well, we'll wait for the Dr. Hema Bindu ma'am. Whenever she comes, we'll, let her come in.
Okay.
And so, as ma'am was telling that this is a flagship program of Central AHA, IAP along. Oh, ma'am is there. Yeah, please.
No, I was just saying that I want to appreciate the team, and I wish them this Wave 18 bring in more, force. And this 18th of every month should be celebrated as Youth Wellness Day. And the UNICEF is also with us, so we are very blessed and happy that UNICEF being working for child health for so many years with so much credibility, and AHA together, IAP AHA together, we can do wonders. I really would like to thank, our Aditya Mahapatra, who's actually my friend and colleague. He has raised to become the additional director at our state government, Odisha. He's our guest of honor today. I also would like to welcome Saeed Ali Ji, UNICEF head for Adolescent Health, and of course, Salima, with whom we got connected. Thank you, Dr. Ali, for supporting AHA in all its activities, especially on the youth front initiatives. And we are very happy that we are involving the youth also in our webinars. Yesterday, we had a successful gynecological webinar, and we had Naumika and Rahul, who had been with us sharing the experiences. They are really so dynamic. We are around 350 youth now, and we would love to see this youth forum also widen. So with this, I wish that today the preconception care and vaccination being the themes, I wish that all our pediatricians take this to the schools, colleges, especially the colleges. We are looking at 18 to 24 years age group this time. And preconception care is a very bold topic, but very much needed. We want our young adults to prepare before they conceive. And this knowledge should be percolated to the youngsters. And I request all the pediatricians and the youth to do some activities, awareness activities in the field from today to maybe 25th. So we'll be sharing with you the PPTs, the banner, how to report the instructions and to the AHA, so that we have a good document of our AHA activities along with UNICEF. So all the best. I request Sunita Manchandana to invite our guests of honor for their blessings and message. Thank you.
Thanks, ma'am. Thank you very much for giving a brief but crisp idea about this program objectives and aim. So without much delay, I would like, we say that no program is successful without the blessings. So I would like to invite Dr. Aditya Mahapatra. He is the Additional Director, Child Health, Government of Odisha. Sir, please grace this occasion with your blessings. So Dr. Mahapatra, sir.
Thank you, madam. Thank you, Hemabind madam, for giving me an opportunity to speak in this forum. I welcome all the participants, specifically the IEPNs and those who are interested for adolescents here. As we all know that Government of India and other state governments are trying hard to reach the adolescents now in every aspect. And I think many programs are going on through Government of India, like RKSK program, Rashtriya Kishore Swasthya Karyakram, and School Health Wellness program. Those things are going on through many employees in the NHM and Government of India. They are trying like this, and UNICEF is also supporting in many aspects to improve the adolescent health. And coming to preconceptional care, if I will speak on that preconception, can I share my slides?
Sure, Dr. Aditya.
Okay. Madam, is it visible?
Yes, sir, visible.
Just
Only
I
thing-
want to I want to speak from Odisha context, because now with support from UNICEF, we have started one preconceptional care. First, I want to speak about the Odisha context where we are in adolescents.
So you can switch to slideshow.
Is it visible now?
No.
Yeah, we're able to see the slide, but not in slide share. Full screen, make it full screen.
Slideshow. You click the slideshow.
I have done it.
Okay, fine. Then it's okay.
Yeah, otherwise we can go ahead with this. Yeah.
Okay, so this is the status at present. We are having Odisha context, developmental disparity. There is yes. Now I think is it visible?
Sir, it is visible. Only thing is that the screen is looking small just because it is not in slideshow. If it can be done in slideshow, it will be good. Otherwise, also it is visible. Agar sir,
I think I cannot make it. Let us manage with that. So
Yeah,
we are
sure.
having 22% tribal population, and many hard to reach areas are there. And key contributing factors are mainly teenage pregnancy, malnutrition, anemia. All these are contributing for highest perinatal mortality rate of our state, and low birth weight is also 24%. and there is no perceptible decline in prevalence of low birth weight from 2005 to 2015 and 16. This is the package in which we were focusing mostly prevention, how to prevent the teenage pregnancy, care during pregnancy, then care of the infants up to 6 months, specifically low birth weight, then management of nutritional deficiency, then identification and prevention of NCD, screening of hemoglobinopathy, malaria. All these things are included in RKSK program. Now through UNICEF, we have started this preconceptional care for specifically aspirational blocks. We have got 29 aspirational blocks in which we are focusing on 4 key groups. That is, one is adolescent girl for anemia.
Sir, sorry for interruption. Just that, do you want to move your slides? Because I can see the bold concepts in other slides.
Is it not moving?
No, sir, it is
Yes,
not
sir.
moving.
Slides are not moving.
Okay. Then I'm stopping sharing and then.
Sir, you go to the top blue line of your this thing. Just adjacent to the home button and just click on the slideshow.
I think it's okay. He's talking about it now.
हाँ सुन रहे हैं समझ रहे हैं स्लाइड की जरूरत नहीं है
You don't require slides.
हाँ
ठीक है
सर आप बोलिए सर
ओके
हम आपको सुनना चाहते हैं
अभी कुछ भी नहीं दिखा रहा है
हाँ देख नहीं
We are able to see the slides, Dr. Aditya. Please continue.
Okay, so just I am telling about our concept and how UNICEF is helping us in this program. That we are having 4 groups. One is adolescent, then reproductive age group, women of reproductive age group, then pregnant women and lactating mothers, in which we are going to start in the form of IMNCI, that assess, classify and action. In that, during assess, we are doing asking some questions, then examining adolescents, then doing tests like hemoglobin, blood sugar, then if required sickle cell, malaria, TSH, T3, T4 and OGTT, all these things are planning to do it. Then classifying as either no risk, moderate risk or high risk or severe risk. Accordingly, we are going to do some actions. Accordingly, no risk children, no risk adolescents will be taken care with some counseling. Then moderate risk will be provided with counseling and treatment, and severe risk immediate treatment. So in that way, this is planned at present through UNICEF in 29 aspirational blocks. So I think in this way we can definitely provide some support to the adolescents, and we can prevent low birth weight baby, and then subsequently the mortality and morbidity of the adolescents. These different platforms like BHSND, then Adolescent Health Day, Adolescent Friendly Health Clinics, PE meetings, or WNCD department with help of WNCD department also we are planning for reaching the out of school girls. Then different Sampurna Prushti Yojana. In this way we are planning, and I think that will be helpful. And also another program is called School Health Program, in which we are reaching the school children to RBSK teams by doing head-to-toe screening and counseling and activities by even our school health ambassadors, those who are teachers trained on adolescent health. So they are conducting weekly activities in the schools to improve the adolescent health. So in this way, I think this is one initiative in which Odisha we are trying to help these adolescents, and subsequently I hope the adolescents will get the benefits of this, and I think this will be a great help. And if IAP will join hands, UNICEF will join hands together, and this adolescent health program will run very well. So thank you again for giving me an opportunity. I think this is all from my side.
Yeah.
Thank you.
Thank you, sir.
Can we respond, Sunita? Just
Yeah,
a
please,
one point.
please, ma'am. Yeah.
Dr. Aditya, we promise that, UNICEF also, I think, is likely to be with us. But from AHA side and IAP, I would commit our commitment to the government of Odisha, and let us know if any technical help we want in terms of, we are with you for the state government and for the adolescent health in the state of Odisha. So let us know how we can collaborate further.
Sure, madam. We will invite you. We have already invited for newborn care in different times. We got your help, and now from adolescents, for adolescents also we will invite you. Thank you very much.
We have grown to adolescents.
Yeah.
So thank you, sir, for your government efforts and assurance that you will be support for AHA as well as Dr. Hema Bindu ma'am, that giving us that mutual work we can achieve best for the youths. So next, I would like to invite Dr. Syed Ali. He is a health specialist UNICEF. As we all know that UNICEF has been working with us, Dr. Salima ma'am and other members are involved in this program. So welcome Dr. Ali to grace this occasion.
Thank you, madam, for the invite. Respected Dr. Hema Bindu ma'am, Chairperson AHA, Dr. Aditya from the Health Department of Odisha, my colleague Salima, Youth Champion for today, Shubhangi, and also all the colleagues from IAP who have joined, and the youth champions who have joined from Youth-Led Voices and other youth-led organizations. So this is a very important topic, ma'am, as you already mentioned, for this preconception care. But there is some, misconceptions that this preconception care is only for girls. This needs to be removed, and IAP, no other than IAP, is in the right position, because the current data of the NFHS 5 shows that the boys 13 to 17 years, 10% of them have this tobacco in any form using, and this tobacco will reduce the quality of the sperms. It destroys the quality of the sperms, resulting in infertility. And we all know that India, 3% is the primary infertility rate, 28% is the secondary infertility rate, which is going on. So it's very important to have both boys and girls together in the preconception care orientations. Now, another point is, again, as you mentioned, preconception, and Dr. Aditya also mentioned, one of the very important pillar of the preconception care is the SRH, the sexual and reproductive health, because it is seen that the young couples, 18 years, 19 years, the use of contraceptive is only 20% as per the NFHS 5. And preconception is the most important period where we can have those guidance and other things and so on. And India is currently struggling with a dual problem of the thinness, where 40% of our married girls, young girls, 18 to 24, are towards that side of the BMI, and 5% are towards the obesity, and both the issues are during the pregnancy is a point of concern. Now, another important topic you have kept is the adolescent vaccination, which is very, very, very important. You might be aware UNICEF is working closely with the Ministry of Health for the launch of HPV vaccination, which is due in a couple of months. And with IAP and FOXY, UNICEF has did five workshops in the last year to have the commitment of the professional body organizations. And I'm sure, Hema Bindu ma'am, under your leadership, we'll be further having this support when HPV is rolled out across the country, and we are targeting at the youths and adolescents in the form of the campaign. Another point, last point I wanted to share, madam, for the vaccination, hepatitis B is also one of the most important area, because now the studies from ICMR says that 1% of the pregnant women will have hepatitis B infection, and 1% for syphilis. And hepatitis B, we have the vaccination. So in terms of percentage, it is very less, but in terms of absolute numbers, it comes to 240,000 women per year suffering from hepatitis B during the pregnancy. So preconception care, I think, is the most important, and thanks to the leadership of IAP and the leadership of AHA to having this topic. We recently did, along with WHO and the other UN partners, a case investment study on adolescents, and the final recommendation, it was released by Dr. Vinod Paul. It says that if the entire country, all of us, families, professional bodies, organizations, spend 33 billion on the youth and adolescent well-being for next 25 years, It will have return of investment 476 billion per year, which contributes to 10% of GDP of the country. So your initiative, madam, as AHA for working for the youth and adolescents across the country, and I can see 84 out of which 70 are the youth champions across the country. I think it's towards the right direction to help economically country moving forward in terms of becoming the third most, economic country in the world. Thank you so much for this initiative. Thank you and best
Thank
of
you, Dr. Ali. Just in response, I would say that AHA is committed and we will work together, not just this year. We'll carry on our collaboration further too. And we would like to see a change in the field. And it is not a one-time affair. We are going to do a sustained activity. And PCC preconception care guidelines have been given by the AHA, by us, a team in 2022. So we brought these guidelines. It is published by the Indian Pediatrics. And we are very happy that Odisha government is taking up in their PIP. I request that all the other state governments through the UNICEF, word of mouth, we can motivate the other state governments also to take up in their PIPs as agenda. So wherever possible, AHA will help it throughout the country. Thank you.
So thank you, Dr. Ali, for very rightly saying that this topic mostly is not being talked much about. So we are here to, bring right information regarding that preconception care and adolescent vaccination. So moving ahead, I would like to invite our dynamic and energetic president, Dr. Vasant Khalatkar. So sir, please grace this occasion so that we can formally start our program. So Dr. Vasant Khalatkar, sir. Hello?
Is he joined?
I'm just seeing it.
So we can have his blessings once. I think he's traveling.
Yeah. So let's see. We'll wait. I mean, whenever he comes, then we'll have his words on this and assurance that what we are looking forward from the IAP as well. So moving ahead, now we have another very important program for today's panel. The importance of this program is that this panel is led by youth. So we call it as a youth-led panel, which is being led by Sneha Sumera and Ektam Gupta. And I would like to invite panelists for these sessions are Dr. Chakrapani from AHA Telangana, Dr. Pradeep Kumar also from AHA, which both have belong from Telangana and have held various positions in the IAP and AHA. Dr. Prashant Karya, he is executive board member of Gujarat. He needs no introduction. Well, I think well-known person. And Dr. Rakesh Chabra, he is director Chabra Hospital. He's from Ludhiana, has been ex-president in Punjab. Dr. Smita Sharma is well-known cardiologist in Delhi. And of course, we know that, the songs which she has brought is definitely, working wonders for us. So, and along with that, this important panel will be moderated by Sumira. She is a student of from KL University and BTech. I think she's doing BTech, and we would like to know more from Sumira about herself as well as now. Sumira, where are you? So the stage is all yours. So
one small correction, I'm Smita Mishra. Not
okay.
sure.
Sorry, maybe slip of tongue. Sorry, ma'am, but we know very well about you.
Thank you so much. Thank you so much.
Please. Yeah, Sumira is here. We can't hear you.
Could you hear me?
Yeah, now we can.
Yeah.
Welcome. Yeah, please.
So good evening, everyone. I'm Samira Kamini. I'm a third year biotechnology student. I'm from KL University, Vijayawada. So firstly, I would like to thank IAP for giving me this opportunity to interact with all of you. And also, I would like to I'm glad that every time on 18th you are organizing this program. That would be a wonderful opportunity for all the youth like me, so that we could interact with you and also learn new things from you. And like today's topic on preconception care and adolescent vaccine, I think this need to be discussed in the youth among us. So we need to know about this very well. And I just have a few questions regarding this. I just want to ask the panelists regarding it. Can I continue with it?
Yeah.
Please go ahead. Yeah.
Yeah. The first one, like we often hear about pregnancy care, but what exactly is preconception care and why should young people care about it now?
Yeah, thank you, Samira. And I thank all organizers of IAP and all stakeholders of this meeting. And regarding your question, the preconception counseling is defined as preparing the couple for a pregnancy, and so that we can avoid the deleterious effects of any ill health which are present in the mother. They can be countered, and they can be the deleterious effects of the diseases can be overcome by counseling. So when should we do this? And we at least 4 months prior to the pregnancy planning, we have to go for preconception counseling, and we have to prepare the couple's mind and body for the pregnancy. So what are the main components and advantages of this? They should they should be screened for physical fitness and mental fitness. They should be screened for sexually transmitted diseases and vaccination counseling to be done. And they should be screened for lifestyle disorders like diabetes mellitus and hypertension, obesity and metabolic syndrome, and some autoimmune disorders also. And we have to screen for nutritional deficiencies are there. If any nutritional deficiencies are there, then you have to look for them. And the important one is iron folic acid supplementation is a part of this. So folic acid will prevent the neural tube defects in the child, in the fetus. So, and any sleep disorders are there, sleep pattern should be disturbed. If a sleep pattern is disturbed, then there should be some HPO axis will be deformed. So that circadian rhythm to be, again, it should be brought back. And you have to counsel for some genetic disorders also. For any sibling is suffering with some genetic disorders, you have to look for. And more importantly, the cessation of smoking and bad habits like smoking and alcoholism and any drug abuse is there, then they also should be stopped. So in a nutshell, we should look for any nutritional deficiencies and any lifestyle disorders and any genetic disorders or any sexually transmitted infections or any bad habits like cigarette smoking, alcohol is there. So they should be addressed, and you have to counsel them for regular exercise and proper diet planning. Okay, so this is all about preconception care. So we have to ask questions and we have to treat them accordingly.
So thank you.
Yes.
And then I would like to ask, can our like current lifestyle, like diet, sleeping habits, or stress can really have, ability to have a healthy baby from years now?
Samira, thank you so much for the question. And what I must say that our life is all about the energy balance, which reflects on our weight, growth, blood sugar levels, and other vital metabolites. So, if we are not having proper nutrition, that is poor nutrition, so poor nutrition, sleep starvation, stress, they are kind of rogues. They are hands in glove with each other. So what happens? Number one, they will actually cultivate the another thing. Like if it is a stress, that will also go into the poor sleep deprivation. It may also go into poor nutrition. Okay, so they are all together and they just keep on promoting each other. So number two is if you are having a sleep deprivation, so what happens is a kind of garage time for our body, where our body has to have repair and the replacements and all system has to be checked. The hormonal, neurohormonal axis, and a lot of things which will be done at particular time when you are sleeping well. Okay, so you just take away that garage time, And then number three is the metabolic dysregulation. So how would you recognize if there is a high, very low BMI or very high BMI, if there is hypertension, obesity. So these things are what they say to you. They say that there is a metabolic dysregulation, and what it will lead to? It will lead to subclinical inflammation. And what will subclinical inflammation will do to you is the kind of polycystic ovary disease. So this is one of the major thing for the irregular menstrual bleed and the poor chances of having the fertility, right? So this is so common nowadays. And also men may have the poor sperm quality. So this is all. So obviously the chronic dysregulatory metabolic syndrome will happen when you are not having the diet, sleep habit, and like proper diet, and you are having the poor sleep habits and the stress. All those will lead to metabolic dysregulation. And whenever you are coming on the table that, okay, now I have a partner, I have a marriage, I want a baby. So these things will come back to you as a hypertension, obesity, poor chances of having a baby. And not only that, antenatal period become more risky period because you are having some metabolic disorder. So this is all about this. Obviously, these all things will lead to a poor conception possibility and the poor fetal health subsequently, and the baby's health subsequently. And also the lot of emotional stress. Am I okay? You understood my point? Yeah, okay.
Samira, we can't hear you.
You are muted.
Yes, ma'am. Yes. Okay. Thank you for the explanation, ma'am. And then I just want to ask, is preconception care is just only for women, or does future fathers play the healthy life? They require a healthy life in it.
Yeah. Thank you, Samira. So, excuse my lack of video. I'm at Bangalore right now at a talk. So, preconception care is not just for women. We know that when women carry the pregnancy, a baby's health begins with the quality of both the egg and the sperm. And fathers contribute almost 50% of the DNA. So, the health, the habits, and stress levels can directly impact the fertility and the child's future well being. You know that sperm takes 74 days to form, and again another 12 to 21 days to mature. So the lifestyle of the male during the past 3 months before conception is very important. Smoking, alcohol, obesity, stress, all can cause damage to the sperm. And studies say that damaged sperm can increase the risk of miscarriages, birth defects, autism, and also ADHD. So studies say that fathers pass on the epigenetic information, and lifestyle impacts the baby's genes. So we also have to remember that not only the maternal age can cause conditions like trisomy 21, but the paternal age can also have an impact on genetic mutations. And obesity, currently even youngsters are, all of them, they are becoming very much, they don't maintain their weight. So obesity, again, that can cause a hormone imbalance. And studies regarding the environment, they say that toxins and plastics can also damage sperm. Again, a much overlooked factor is stress. Stress is key, actually. So stress can impact the testosterone production and also affect the sperm quality. So we have to conclude that a healthy baby means a healthy mother and a healthy father. So both are needed, and we have to start early to invest in future care. Thank you for the opportunity.
So thank you so much, sir. And then I just want to ask a next question. At what age should someone ideally start thinking about preconception health? Is the college age is too early, or should it be thought in that age?
Am I audible, Samira?
Yes, sir.
Okay. So, Samira, as per law in India, the legal age of adulthood or the age of majority is 18 years. That means one can go for voting, enter contracts, and make financial decisions after one is 18 years old. And also under the Protection of Children from Sexual Offence Act, 18 years is considered the legal age of consent for sexual relations. So I think 18 is the right age we should start giving preconception care. And as far as college is concerned, most of the children will be 18 when they enter the college, maybe professional college or degree college or whatever colleges they go to. So college is not late. It's the right time. We should target the youth for preconception care. Thank you.
Yes, sir. I think it is well said. Even youngster like us, we need to know about this.
Definitely.
Yes, sir. Next, going on to the next question. Like, does the health factor affect the preconception care? Like anxiety, depression can impact infertility of pregnancy outcomes or
Stress as such doesn't directly lead on to infertility, but it definitely reduces the chances of conception. As Dr. Pradeep also mentioned that stress can, in stress, whenever there is a lot of stress, there is release of cortisol hormones, which can disturb the hormonal cycle in female, leading on to, delayed ovulations or anovulatory cycles, or there can be some can be missed even after the woman gets pregnant. Along with it, there can be practical challenges. There can be reduced sexual frequency and decreased enthusiasm, a lack of libido in both male and female, which can impact conception efforts. In males, especially, there can be low sperm count, there can be decreased sperm motility, there can be altered morphology of the sperms, which can cause decreased chances of conception. And also in males also, the stress can lead on to some imbalances in testosterone and prolactin levels, which can lead on to problems like sexual dysfunction. There can be erectile dysfunctions also. There can be uh, people with depression and psychosis who are already on antipsychotic drugs. These drugs block dopamine receptors and also cause some problem in serotonin uptake. So these can lead on to loss of libido both in males and females, and erectile dysfunction in males, which can have adverse effect on the chances of conception. So these things have to be addressed before the couple plans to have a baby. Thank you very much.
thank you, sir. Thank you for the answer. And next, I just want to ask, we hear a lot of things about ECDs, like chemicals in food, plastics, and packages. How serious they impact the future of reproductive health and hormone balance?
So thank you, Samira. See, when we are talking about this ECDs, the endocrine disrupting chemicals, they are there in each and everything which the adolescents may be using. So that's important that we are taking care before the conception happens. Say, for example, some examples of these chemicals, like the bisphenol, which is there in the plastic containers, it can mimic like a estrogen. Pesticides, which are there in agriculture items, again can mimic like estrogen and thyroid also. The parabens in the cosmetics, in all the makeup items, which is there in shampoos, in lotions, which is there, again can mimic like a estrogens. Even the industrial waste can be a problematic, and sometimes this may lead to hormonal changes. Like which hormonal changes? This chemical substances may mimic like a hormones. They bind to a hormonal receptor, say for example to estrogen or a androgen, and that causes a exacerbation of the normal hormonal changes which can be there. Even sometimes they block these receptors and doing the reverse effect in form of a antagonism. Now, these changes which are happening in a receptor due to these chemicals may lead to a DNA changes, and the epigenetics can also be a problem. So this can lead to a transgenerational changes. And once it causes this type of disruptions, it can cause the issue with the HPG also, like the hypothalamo pituitary gonadal axis. Now, when we talk about all these things, what is the impact of all these things? If we talk about females, you see, we are seeing the early puberty due to all this estrogenic substances stimulation. We are seeing menarche by around 9-10 years. A precocious puberty is at a rise. Even the irregular menstrual cycles or the PCOS may be a problem. The science says there can be an issue with the ovarian reserve, like the follicular genesis disruption can also happen, and it can cause the endometriosis also, which can lead to a further infertility in a female. When we talk about a boy, that can actually cause reduction in a sperm count and a motility decrease in testosterone levels, as well as the testicular dysgenesis can also happen. And it's been seen that in children, the offsprings, there can be increased risk of cryptorchidism and hypospadiasis if prenatal exposure is there. As I said, it can also lead to a thyroid dysfunction. So there can be altered neurodevelopment in a next generation can be there. And other hormonal changes which are happening due to this can cause a risk of obesity, insulin resistance, as well as the metabolic syndrome. So for us as a pediatrician or adolescent health counselor, it is most important that we teach adolescents that the simple cosmetic thing, the simple food packaging thing, simple preservatives which you are consuming may lead to this type of issues also. So beware of all these things. Thank you so much.
Thank you, sir. I think before using all these cosmetics, we need to be aware this time.
Yeah.
Thank you, sir. And the
And
next,
most important is misleading
Yes.
cosmetics, which is there. A Fair and Lovely. I mean, that is the most misleading advertisement. Even the diet and the nutrition packages which are there, that also lead to a zero figure, and that again lead to all these things will be a problematic.
yes, sir. Thank you, sir.
Now Fair and Lovely, they have changed the name as Glow and Lovely.
Yeah.
Because of this misleading issue.
Yeah.
Very right, Sri sir. Very right. They have changed the name.
Yes.
And then I just want to ask, like, these days we see like fitness trends and supplements using in gyms. Do this really affect the fertility and related things?
Yeah, Samira, this is a new trend nowadays. Fitness freaks, they are all become fitness freaks. So in इसका चक्कर में सब लोग क्या कर रहे हैं? They are taking inappropriate drugs like anabolic steroids and to improve the muscle strength, and they in turn cause the disruption of the hormonal imbalance, and they lower the sperm count, and sometimes if you use danazol or some steroids, they can form adenomas in the liver, and in females also it causes some infertility, and they are doing extreme diets sometimes. So it may affect HPO axis disturbances and poor egg quality in males. It is poor sperm quality in males and poor egg quality in females. So you have to do regular exercise and say no to steroids and say no to sugar containing protein powders, so that the other metabolic syndrome cannot occur. And take natural food, natural protein containing foods like soya bean, like that, or chickpea, and you can take natural protein like a chicken or like chicken and egg, but not these sugar containing protein powders. So this is what about the fitness and fitness extra supplements which are given by non-nutritional specialists. So you should avoid them. Okay.
Thank you, sir.
Samir, just 1 minute. I like to, sir, say one or two things which these adolescents are doing and which must be taken care. The adolescents who are doing gym are actually prone to three things. First is anabolic steroids, which they are giving for the muscle mass building. And they don't know this anabolic steroids can actually decrease the sperm production, decrease the size of the testicles, and cause mood swings as well as the future infertility. So that is strict no. Second is a crash diets. See, usually what happens is this adolescents who are doing gymming is mainly doing crash diets just to decrease the weight or to have a zero figure. Now, girls don't know that if you do crash diets in your this period, then that disrupts the ovulation, affects the egg quality, and again an infertility issue will be there. And the third, as you already covered that, but yes, protein overloads. I mean, 1 to 2 gram per kg is normal recommendation, but the whey protein, the isolate protein, all the supplements which they are taking, they don't know that the excess of that can damage the kidney as well as do the hormonal imbalance. So without the guidance of a doctor, never ever take these supplements. This is what I wanted to add. Thank you, sir.
Proteins, excess
also
proteins
want
will
to-
lead to either they may be ketogenic or glucosenic. They are ultimately they are converted into again fats and glucose. So insulin resistance may be increased. So that is another point.
So I also want to make a point as a cardiologist, because having too much of muscle is not always good. And it has been proven that immunological health is good with the moderate exercise, but extreme exercise actually is not very favorable. And if you are putting lot of muscles to your heart, there is a mismatch between coronary circulation and the muscle mass, and that is never a good thing. So one has to be very careful when going for a extreme training and cardio exercises.
So, ma'am, can we say to the adolescents that gymming after 18, before that, actually a strength building by anaerobic exercises or a cardio will be much more beneficial?
Yeah, that I always say that you should not be like before 18. One has to be very careful about the extreme exercises, weightlifting, isometric exercises, because your cartilages and all those things they are developing. So dynamic exercises remains the good thing. Cardio in the supervised manner, yes. One should be knowledgeable when you are going for that. Hello?
Yeah.
Yeah.
Yes,
Please
Samira,
continue.
please. Yeah.
Actually, yeah, ma'am, this topic needs to be discussed because every people of our age group are so much interested in going to gym and taking all these supplements and all. So the next one I would like to ask is like nowadays our screen time is being increasing and digital addiction is being so much more. So does this really impact the reproductive health?
Yeah, so right now we are talking about something that affects almost all of us here, screen time. So phones, laptops, social media, these are a big part of our lives these days. So overuse naturally comes with hidden costs. What we see, how long we stare, where we use the screens, this can impact an emotional or a reproductive health. So the main thing to note with phones is they emit this blue light. And this blue light research says that it suppresses the melatonin synthesis, leading to poor sleep. And it can also disrupt hormones like GnRH, FSH, and LH. We all know that these hormones regulate periods, the menstrual cycle, and also the sperm production. So naturally, screen overuse will cause disturbed circadian rhythm, and also hormonal imbalance because of that will reduce fertility. And the other thing that we all have to address is exposure to pornography or violent content, that is through gaming or other videos like YouTube videos and other OTT platforms. So this exposure, this constant exposure, this directly alters the dopamine reward system, and this can lead to anxiety. And otherwise pornography can also cause unrealistic expectations, performance issues, and also emotional detachment. So main thing to we have to address is that pornography promotes unrealistic expectations about intimacy, and this is not good for fertility. So even otherwise, screen addiction, the other things like because they are always glued to the screen, they'll have less physical activity, the junk food intake will be higher in them, and then there will be higher depression and anxiety in these people who use. So all of these contribute to hormonal imbalance and fertility issues. So to come out of all this, we can't just say that you do not use your phones at all, but smart screen time, like having timers and enabling the blue light mode at night, and staying connected offline, and consuming media mindfully, that mindfulness where we stop this doom scrolling and constantly looking at videos and stuff like that. So you protect your mind today, you will protect your future fertility and relationships. Thank you.
Thank you, sir. And next one I want to ask, like, what are the simple steps right now as a students we can take to start building a foundation for healthy future parenting?
Hello? Yeah, Samira?
Yes.
Yeah. So who is supposed to give this answer, please? Say.
Just a minute.
You can repeat the question again.
Yeah.
Because there are some technical glitches. I think you can repeat the question.
So I think Samira is asked what simple steps can students or young professionals can take for healthy future parenting. As such,
Yes, sir. Yes.
yeah, the expert.
Or meantime,
So hello, I am answering this question,
Yeah.
right? So in one line, by being responsible and respectful to yourself and your partner, be loving, caring, but also maintain the respect and understand the what are the problems going on. Vaccinate yourself. A stress-free life is impossible for any person, but stress management is your job. So that you have to do it. Workload, you cannot control how much you are going to get, but time management is your cup of tea. World is not going to make you happy till you are happy yourself and making world happy. So it's not like from outside inside happiness will come. So that happiness is very important for your regulation of metabolism. The choosing right food, exercise, right mood, most of the time is the way forward. Yoga, meditation, chanting, staying away from substance abuse, as it has been said, and the cosmetics and the your food item, what you are eating, the packaging, the kind of pesticides, the fruits you are taking and washing them off very nicely because so many times they are colored. So all those things to be taken care of, and these are the simple way. Just you have to adopt it right from beginning. Then only you can be always regular on that as an youth or subsequently as adult. And ultimately, the disciplined life, restrained life, where you are not too much of pushing things for yourself or anybody else, and you have to develop a capacity to discretion to what you are doing, how much good it is for you and for the society. So you have to manage the everybody's well-being in your mind, and then only you should move forward, and that makes you happy. And when you are happy, your metabolic system is also happy. That is what I feel, what has been told before also. So this is my answer. Thank you, Samira.
So thank you, ma'am. And the next one, I just want to ask that there is a common fear talking about preconception health is only for married people or the pregnant people. Like, how do we just normalize this conversation?
So Samira, if you want to normalize the conversation, we have to start it early. See, remember, if you're going to a road trip and if you don't have a petrol, then you will not reach to that destination. You have to fuel it beforehand. So if a girl or a boy want to become a parent, they need a information beforehand. And as you said, what are the things they should be knowing? So for that, I think we can have few things beforehand ready. Like what I said in some of my talk is, when we are talking, we don't say it's a preconception care. We say it's a healthy lifestyle changes, a mental and physical wellness which is there. And for that, we usually say it's only a family first. That means this is a mnemonic which I usually use. A family first. Those who know me know that I'm fond of mnemonics because it makes me easy to give my talks. Family first. F means food. Now food is the most important thing. If that is there in right way, as Smita ma'am also said, that if fuel is better, I mean if it is right, then there will not be an issue. And in adolescent age, if the habits form of a nutritional foods, then there will not be issues. We all know that more than 50% girls are anemic, and if the anemic girl becomes pregnant, the offspring will be IUGR or a low birth weight. That can lead to a same cycle. And if you want to decrease that cycle, first and foremost important thing is take care of your nutrition, a food. As we said, folic acid, somebody said before and also, but that is preconception. So we say take it 4 weeks before a conception is planned so that the neural tube defects can be postponed or can be cancelled. So that is one thing. So F is for the family start is food. Second is active lifestyle. Always have a 30 30 minutes to 1 hour of physical activity, and that is helpful not only for your physical fitness, but yes, for the preconception care also, because it increases your fertility. Mind it is scientifically proved. Most important M is mental health checkup. We are having issues. We always say on mental health days, 1 in 4 is always having a mental health issue. It's okay to be depressed, but then we don't talk it openly. We have to talk it openly and clearly. Then that will not be a problem. Fourth I is immunization. See, when I say to the preconception care that you have to take a HPV vaccine, you have to take a Tdap vaccine, you have to take hepatitis B vaccine, all these vaccines, when we say, they think this doctor is promoting a vaccine, but actually we have seen the issues which are happening. See, if the mother has not taken a rubella vaccine, I've seen a child born with a cataract and a heart disease and a deafness that is preventable if the rubella vaccine was taken. So immunization, most important, which we say. Fifth L, family L, is limit toxins. I mean, this adolescent or young adults are fond of experimenting, and tobacco, drugs, and alcohol is most prevalent in this age group. So in this age group, if we give them the advice, then that will be a better thing. And why is a youth habits matter the most? Whatever habits are there in youth, that will be there throughout the life. So that is there. As rightly said again by one of my friend, that screen time control habit should be there from this age. So that is start screen. Then comes T. T is most important, which many a times girls are forgetting. That is track your cycles. See, my daughter is 14 years and she has just downloaded an application, a fertility app. I mean the ovulation app, not the fertility app, so that she comes to know whether the periods are regular or not. If that is irregular, that can cause the infertility in future, maybe a PCOS. Irregular periods may be a first thing. So always track your periods. That is what we say. A is for ask about a family history. If in family somebody is having some issues that can lead to a genetic issues in this girl or a boy also, so it must be asked. And then last is reproductive health education. We all are having a shame in talking about the reproductive trait issues, but if that has been talked early, that can help. And last T, which is mainly missed, is talk to a doctor. Just have consultation with a doctor. Instead of matching your horoscope, talk to a doctor and match your thalassemia status. That will be beneficial for a future generation. So this type of things, when we say in a different words, will be helpful. And always start early. Early means it can be started from the early adolescent also. So this is what I wanted to tell. Thank you.
Very well said, Dr. Prashant. And I will re-endorse about one thing, that is rubella vaccine, because I meet these couple who are having the rubella child, chronic rubella, congenital rubella syndrome. The problem is, Dr. Prashant, because rubella is a vaccine, you don't have the 100% immunity against it after 1 or 2 doses. Even third doses, you may get only 90% this thing. And interestingly, what is happening whenever a torch test is being done, so rubella antibody negative should be taken seriously by the doctors, by the person who is going to get it. And also probably the adolescent girl and this age group should be given rubella, and they should ask for it, because changing age group of the rubella vaccination, MMR vaccination and the rubella vaccination, has left a chunk of the patient who actually never get the second dose. Which was initially in my days, it was MMR 18 and then subsequently 14 years. But there was a change in this thing, vaccination schedule. So one has to be very careful, because rubella is absolutely preventable. So that is very important.
Dr. Prashant, I would just like to ask you a question. You raised a lot of important issues right now. We are a set of people who are very educated in this, strata. However, if we go to the rural strata, how would you basically, take care of the preconception care at both male levels, female levels, as well as the people?
So Nomika, see, it has nothing to do with rural or urban. I'm in an urban area, but we do have schools who are there of a Surat Municipal Corporation. It's of a lower socioeconomic class. The most important thing is never talk sexuality first. When you talk preconception care directly, they will not listen to you at all. Just talk about a healthy lifestyles. Say, for example, everybody knows that nutrition plays a role, a sleep plays a role, exercise plays a role. Just start with that and then just say, do you know that the menstrual irregularity can also be a problem? And let them say yes. And then you talk regarding a reproductive sexual health topic. So it's just a way by which you present. Otherwise, all the crowd is same. And one more important thing, I mean, I'm taking sessions since last 15 years, and the rural girls are asking more bold questions than the urban girls. So that is, I mean, they ask you openly anything. Just to give you example, is it safe to wear 2 condoms? Okay, this is just this type of questions also the girls are asking, but provided they are given a safe space. So first, always start with the ABCD and don't directly jump to a sexuality.
Also, sir, this I would like to point out since I am a student who is pursuing masters in psychology. We are also told that in rural areas there is no primary health care that basically involves a psychiatrist or a clinical psychologist that is RCI licensed. So how do we provide safe spaces? Because nobody is able. If I say, "Ki somebody go to Chhattisgarh rural area," nobody would go there.
Okay.
That is the problem.
So, Nomika, the first thing which you said, I totally agree. If we talk about a psychiatrist, see, one of my friends said that for every 700 public, there is 7,000 public, only one psychiatrist. Now, there is a lack of healthcare professionals. Adolescent Health Academy is doing the same work. We are 3,600 members. We all are actually learning from each other and providing these things to all the students. Now, when you talk about the rural things, if in a rural area, one doctor is there who wants to learn adolescent health, let him become an Adolescent Health Academy member. Once he becomes the members, he can learn all the modules. Then he can go to the schools. Say, for example, a nice initiative of AHA is Teach module, in which we don't want doctors, we want teachers to enroll. Once the teachers are enrolled into that, they talk to the school. So that is a safe space. See, for a girl, first safe space is mother. The second safe space is teacher. Third safe space is a doctor. So if you can teach the mothers, if you can teach the teachers, then that will be done. And for that, we need a pool of doctors. And for that, they have to become a member of AHA.
Well said, Dr. Prashant. I agree that ultimately it's not only doctor can convey the healthful lifestyle messages. There the society has to be recruited, and that is what is happening with this AHA. And I really congratulate the AHA and Dr. Himavin Singh for her leadership and the whole group's leadership.
And Dr. Prashant, just last question. Can't counselors play a role in this place?
Can I request Dr. Prashant to be quick, please? Just that we are running short of time. So we would like, please, go ahead. Sir.
I just missed what is the role of counselor, you asked.
No, not the role of counselor. I wanted to ask if counselors can also be involved in this process.
Definitely, AHA is promoting that. The counselors are a member. Even we are promoting parents also. So that's why we say that we want to make a big pool of trainers who can help these adolescents.
Great. So, Samira? Yeah. Any more questions, or we are okay now?
Yeah, ma'am, I'm done with my questions, and thank you for providing me this opportunity so that I can interact with all of the panel members.
So thank you. First of all, I'll appreciate your efforts and the way you conducted this panel. It's really good. And definitely we would like to, have youth members more and more in this platform. Along with that, I would like to thank our esteemed panelists for giving us a crisp information about this untold topic, preconception care. So, and I could see the two persons, Zonam Sangama from Meghalaya and Love Kumar Singh as a champion of youth from West Bengal. So I will appreciate two of you to please give us a comment after this next session, and which is adolescent. The topic for the next session is vaccination. We have given a basic, information during this session as well, that the vaccination is an important part of the preconception care. For this, I would like to invite our panelists. They are Dr. Kalyani Patra, who is adolescent pediatrician from Navi Mumbai. Dr. Pratik Dev, he is a pediatric specialist from Health and Family Department, Odisha. And Dr. Ram Bharat, Executive Board Member, AHA Maharashtra, so he's from Chandrapur. And Dr. Satvik Bansal, he's from Gajraja Medical College, Gwalior, EP member, Central Zone as well. And well, our youth for this panel is Mr. Pavan Kumar, who is a not a medical student, and he is a student of college in KL University, and would like to know more about you, Pavan, by your mouth. So welcome. So I request Mr. Pavan to moderate this session. Yeah. Can we see him? Dr. Srisalam?
There, he has to unmute.
Yeah, he's there.
He has
Yes,
to unmute.
yes, ma'am.
Pavan, unmute.
Yes,
Yeah,
ma'am.
please. Yeah. Hello. So please.
Yes, ma'am. Thanks.
Just give a short
a
introduction.
very good evening.
Yeah.
A very good evening to all doctors who are present here, and I'm so blessed to have with such great doctors and great seniors of us. And I am Pavan Kumar. I'm studying first year of CEC department of BTech, Bachelor of Technology in Computer Science and Engineering department. I am studying in KL University, Vijayawada. My native place is Andhra Pradesh from Nellore. I'm so excited to join this webinar, and I'm so happy to join here with such a great persons. And I would like to start asking questions to our panelist.
Yeah.
Pavan, before you start, just reminding you, this panel of the 25 minutes. So all panelists are requested to conclude your presentation as short as possible. Pavan, you can start now.
Sir, I can't hear. 1 second, can you repeat, sir? Is I'm audible?
Yeah. You are very well audible. You have to unmute yourself and you have to start the panel. You have to complete your panel within 25 minutes. So keep that time in the mind. Okay, sure.
Yeah, yes, sir. Yes, sir. I would like to ask my first question to Dr. Kalyani, ma'am. A very good evening, ma'am, to you.
Good evening.
My first question is about most of us associate with vaccines with childhood. Why do teenagers need vaccines too? Are we still at risk?
Yeah, even though we get a lot of vaccines in our childhood, adolescents, teenagers do need vaccines. Let's first start with what is the physiology or how vaccines are working. So what vaccines does is it gives your body a safe preview of a disease, and then body prepares antibodies, memory cells, which when the real germ or the infection comes, then your body fights its back. But whenever we are receiving these vaccinations in childhood, as we grow, as we age, our immunity changes, our body change. So also the immunity we have got from these vaccines also decrease. So to boost this immunity, we have vaccinations in adolescents also. So these are like a reminders to our immune system, which help us boost the immunity what we have received in childhood through vaccinations. Also, as adolescents, you move around, you become more social, you go to colleges, schools, you are into sports. Also, you are learning and going outside, living in hostels or maybe abroad. So more interactions with people, more interactions with germs and more infections. So adolescence is again a period where we need to protect them from these kind of infection. Certain infections, for example, I'll tell you, like hepatitis A, which is a viral hepatitis, and chickenpox. If these infections are happening in later age, then they can cause complications and which sometimes require hospital admissions. So latter adolescence is a risk age where these kind of infection can actually decrease your productivity.
Also, let me talk about something. There are illnesses which occur in latter part of adolescence. We already have been talking about HPV since the session has started. And HPV, hepatitis B, these are the infections which are more likely to occur in the latter part. So adolescent to need to get vaccinations against these also. Also, there are group of adolescents who are battling some chronic medical condition like chronic asthma, there may be a heart disease, there may be diabetes. So these kind of adolescents have an immunity which is less. So they need these vaccinations more because they are vulnerable to certain kind of diseases because of their conditions. So these are all conditions where adolescents need these vaccinations to protect them from these infections and to boost their immunity. Am I clear? Pavan? Pavan?
Hello?
Pawan, if your network is poor, you can switch off the video and you're still unmuted.
Yeah, sorry, sir. Sorry for disturbance. I have running with my network issue.
Yeah, if you have the network issue, what you can do is switch off your video.
Yeah.
Just you can ask.
Yeah, yes. Thanks, ma'am. Thanks. Your explanation was so nice. And we are moving around different places and we are attacking with different germs and different diseases you are saying, ma'am. As many of we are not awareness of that, ma'am. These really in this age group, why we need to take this medicine and these vaccinations is most of us people we are thinking like that only. Even my friends also they'll think about that. For that, which awareness is best to think among themselves?
Definitely. This is something what we are doing now is a kind of awareness we are creating among themselves. And we want to create this awareness among more and more youth. So you are, whenever the correct information gets you, I think you're definitely going to work on it because you want a bright future.
Ma'am, yes, ma'am, yes, ma'am. Thank you, ma'am. Thanks. And I would like to ask my second question to Pratik Kumar, sir. Good evening, sir.
Good evening. Good evening, everyone. Good evening to all the esteemed dignitaries. And I'm thankful to the AHA chapter, especially Himabindu ma'am, as this is my first stance. And I'm thankful to all the think tank and the senior persons. I'm hopeful that I'll be giving appropriate justice to the opportunity given to me. Yes.
Yes, sir. My question is about, can you explain in a simple terms what the HPV vaccine is and why it is important, especially for boys and even girls?
Yes. So I think the preliminary introduction has always been already been given regarding HPV vaccine. I won't stress. I would like to explain it in a very simple term, since you are also non-medico. Human papillomavirus vaccine is basically a crucial part of immunization by a series of shots in order to prevent and protect us from the development of various anogenital and oropharyngeal cancer, of which cervical cancer is one of the most common, and it is mostly acquired during early adolescent. So that is the first part of the question, what is an HPV vaccine? So why it is important for girls? Of course, it is a vaccine. Initially throughout it was important for girls, but now when we are moving forward, we have also found out that boys are also equally needing this vaccine, because we see that every year around 46,000 people get affected. And human papillomavirus causes apart from the cervix, it also causes cancers of the tongue, tonsil, and anus, and also causes anogenital warts, which are basically more common in males. And it is always advisable, as per the American Academy of Pediatrics and also the Indian Academy of Pediatrics, they recommend that these in the pre-teen age group, especially the 9 to 14-year age group, both the boys and girls should be vaccinated, must be vaccinated, because during the pre-teen part, before the exposure to any sexual activity or any trigger, the boys and girls both should be vaccinated. The vaccines now available are recommended for both boys and girls. So due to the disease burden, cervical cancer, it is for the females. And apart from that, HPV is also responsible for causing many cancers which are affecting the males. One interesting fact, CDC did a study. It was around, I don't remember the accurate year, maybe in 2018 to 2020. They documented a significant rise in oropharyngeal cancer in males. And the most interesting part is the males who were affected. The males who were affected were mostly in the 20-25 age group, and astoundingly, they were all non-smokers. Without any habit of having any smoking or tobacco habit, they were getting affected with oropharyngeal cancer. So due to this, considering this present scenario in the society, even the ACVIP, which is the Advisory Committee for Vaccination and Immunization Practices of IAP, it has given a gender-neutral vaccination initiative. Now, what is the gender-neutral vaccination? Gender-neutral vaccination is a kind of a pilot project or pilot thinking where human papillomavirus HPV vaccine will be given to both the males and females, so that due to this, it will not only protect from cervical cancer, but also from the non-cervical HPV related illnesses in both male and female. So it will reduce the transmission of the virus. It will impart herd immunity, due to which the society will be benefited. So this is the ACVIP recommendation that HPV vaccine should be administered to both males and females. Preferably, they start any sexual activity, and preferably to be given during the pre-teenage group, because at that time there is a robust antibody response. So it is always better when the antibody response is highest, that is the 9 to 15-year age group. So that is why HPV, the dosing is also based on that. We are giving 2 doses, 6 months apart from the 9 to 15 age group. And from beyond 15 years, there are 3 doses at 0, 2 months and 6 months. And the gap between the first dose and the last dose should be more than 5 months. And I won't try to explain more on the disease part, because the next question I'll be facing, we can enumerate on that. So basically, that is the thing. The spectrum of disease the HPV virus is causing is not only affecting, we know about cervical, but apart from cervical, there is oropharyngeal cancer, there is penile cancer, there is anal cancer, which are affecting the males. So for adolescent, both males and females, HPV is a very important vaccine, and this gender neutral initiative should be continued. Thank you.
And your insights are very valuable to us, sir. Thanks for your sharing your expertise. And I'm really knowledgeable by listening your answer. And thank you, sir. And my next question I would like to ask to Ram Bharat, sir. Ram Bharat, sir. Good evening, sir.
Good evening, Pawan, and good evening all, and thank you for this opportunity. Yes.
Sir, I would like to ask question to you, sir. Some
Yes.
parents and teens worry about vaccine side effects. Are adolescent vaccines safe, sir?
Yeah. So many parents and adolescents are concerned about safety and efficacy of vaccines, but all vaccines, those are recommended for adolescents. They have been rigorously tested for safety, and they are found to be safe and usually free from severe adverse reactions. Whatever adverse reactions are there because of adolescent immunization, they are usually mild and self-limiting. There can be certain local adverse reactions like pain, redness, swelling at the site of injection, or sometimes there can be some systemic symptoms like fever, myalgia, headache, fatigue. Those children who have risk for syncope or fainting, they may have fainting or syncope after vaccination, either because of previous history of syncope or because of certain needle phobia. and very rarely, means very, very rare, at incidence can be 1 in 1 million adolescents can have severe allergic reactions, and these adolescents are those who are having underlying chronic diseases or underlying immunodeficiencies, or they have past history of severe allergic reactions. Otherwise, by and large, vaccinations which are given to adolescents, they are safe and free from severe adverse reactions. Thank you.
Thank you, sir, for your explanation that so clearly to understand it is a very better way. And thank you very much for your answering this question.
Thank you.
And my next question is for Sarthik, sir. Good evening, sir.
Very good evening to you, Pawan. And believe me, we are as happy and as excited to see you and meet you and other youth as you all are. And I
Thank you,
would like to congratulate and thank respected Dr. Hema Bindu ma'am and Dr. P.V. Arya sir and team AHA for this beautiful program, and as it catches actual essence of the Indian Academy of Pediatrics. Thank you. Please go ahead with your question.
Thank you, sir. Thank you. There is a belief that if we are healthy, we do not vaccine. Is that true? What's a real purpose of these shots?
Thank you for your question, and it is a very, very valid question as well, because we do something only when we can understand the logic behind it. And the general conception is that vaccines are used for illnesses. So if we are healthy, why do we need them? And it's very valid. The point being that vaccinations are not used to treat illnesses, they are used to prevent illnesses. So in actual sense, vaccines are an important aspect of remaining healthy. So you can catch an illness when you are healthy, and to prevent you from catching that illness or those vaccine preventable diseases, there are vaccines. The other important aspect is, even there are certain diseases such as measles or even whooping cough in which you may be infective, but or you may be mildly infective, you may be having some minimal symptoms, but then also you can be a reservoir for spreading that illness to others. And in those people, this illness can form a more severe route or can take a more severe route. So it is an important aspect of community protection as well. These are the two things that are very important to know. The third being that the aspect comes कि भाई vaccination से क्या, मैं तो जब ऐसा illness होगा तो उसके बाद अपने आप immunity develop हो जाएगा. Why do we need such shots? The thing is this, as we have already discussed by in the panel discussion, that these vaccines are actually inactivated or weakened form of these organisms that can cause the illness or parts of the organisms. So this basically teaches your immunity that if this actual illness comes, how do you respond? So that is the objective.
Please, somebody can mute Sneha, I think. Okay, please go ahead, Dr. Sarthik.
So these are the three things that we have to keep in mind to remain healthy. First, to prevent this illness from spreading to others. And lastly, to understand that it is better to be vaccinated than to have a natural illness, which can lead to certain complications. I hope I am able to clear your doubt in this, Pawan.
Sir, yes, sir. It is really helpful to many of us who have joined this webinar. And your insights are so clear and so understandable into us, sir. Thank you, sir. And I would like to ask my next question to Kalyani ma'am.
Yes, Pawan.
Yes, Kalyani ma'am. Yes, ma'am. I would like to ask a question to you. What are the key vaccines that every teenager in India should ideally get?
So Indian Academy of Pediatrics strongly recommends vaccination for adolescents between 11 to 18 years of age. As we have already discussing, the most important vaccine among all is human papilloma virus vaccine. In detail, has been already answered by our panelist. So HPV is the first priority of vaccine every adolescent should get. The second vaccine which is advised is Tdap vaccine. So what Tdap vaccine is? It is the vaccine which protects you against 3 diseases: tetanus, diphtheria, and pertussis. Pertussis is the whooping cough. So this DPT vaccine you already have received during your childhood, but as you grow, your immunity drops, and this booster during adolescence is important. We know that diphtheria is not that common. Also, tetanus is rare, but tetanus is fatal. And as adolescents, you are into sports, injuries. So tetanus is something you should be aware of. So this boosters gives you protection against tetanus. The other thing we were discussing was whooping cough, that is pertussis. So the Tdap vaccine give you protections against pertussis. So pertussis is a disease now. It is again decreasing in the adolescent, but adolescents are the main reservoir of the infection. What do you mean by reservoir? That I may get that infection, that bug may stay inside me. I may not get symptoms, but while I am having that bug, I will carry forward that bug to the people around me who are vulnerable. Like if I have an infant in my house or an elderly person. So these adolescents are a reservoir for whooping cough and pertussis. So Tdap has become a really important vaccine if you want to take protection against these 3 diseases. Another vaccine which is important and recommended by IAP is a typhoid vaccine. So typhoid vaccine comes as a typhoid conjugate vaccine, and you need a single dose between 10 to 18 years of age if you have not received it earlier. Another point is, even if you have had a typhoid, you still should get this vaccine and protect against recurrence of typhoid. Other vaccines important are hepatitis A. So what is hepatitis A? We all know it's a acute viral hepatitis, which usually results from contaminated food or water. And as adolescents, you are eating outside. So you are staying in hostels, so sanitation facilities, you don't know. So these kind of diseases which can actually be debilitating and serious. So you need to get protected by taking these vaccines. Hepatitis B also we discussed that this disease which can cause chronic hepatitis and which is usually transferred through serum or fluids or blood contacts. It is another disease which is of important, and if you have not received vaccines earlier, you need to get it. As we already discussed about rubella, that rubella can cause congenital anomaly in fetus if the mother is affected. So measles, mumps, rubella, these 3 diseases we protect while giving the MMR vaccine. So if you have not been got these vaccination previously, you can get these vaccinations in your adolescence also. There are certain vaccinations which we advise in special conditions. Like I already said, if somebody is suffering from some chronic illness, then the immunity is less. Then in such cases, we advise vaccinations like influenza. Then we also advise meningococcal vaccine, pneumococcal vaccine. So these certain vaccines depend on the situation of the adolescents. Also traveling abroad or traveling to areas where certain diseases are endemic. If you are traveling to say South America or Saharan countries, then you need to take the yellow fever vaccine. If you are traveling in India only, in the areas where Japanese encephalitis is endemic. So in such cases, you need to take the vaccines for Japanese encephalitis. So these all are the vaccines which are recommended by Indian Academy of Pediatrics to adolescent. It is very important that you consult your pediatrician, share your previous records with the pediatrician, and get to know whatever is pending and protect yourself against all these diseases. I think I'm clear.
Yes, thank you, ma'am. As I am non-medical student, I can clearly understand your valuable words, and by listening to you, I myself will motivate, and I myself will give awareness to some of people that our health is such a big thing. We have to care about it. And I have a small doubt regarding this, ma'am.
Yeah.
Many of us parents, they are thinking that, especially for some parents are thinking that even my child is suffering with long-term disease, even though this vaccination is recommended or not.
Can you reframe me it again? I'm not able to get it.
even my child is having a long-term disease,
Yeah.
even though this type of vaccinations is recommended to my child or
Yeah,
not?
yeah.
Yes.
Yeah, actually they are recommended more when you are if a child is suffering from a chronic disease, then it is affecting his overall health and his immunity. There are certain illnesses where specific type of organism is more likely to get you. So, for example, if you are having a debilitating asthma, you are on inhalers and there is flu epidemic, it is very important that you protect yourself by taking that flu shot.
Yes, ma'am. Thank you, ma'am. Thank you for valuable words. Next, I would like to ask Pratik Kumar, sir.
Yes.
Sir, I would like to ask a question to you, sir. Does taking vaccines in adolescence help prevent cancer or long-term disease later in your life, sir?
Thank you. Thank you for your question, Pawan. Of course, taking vaccination, because vaccination has the potential to avert the chronic and acute illnesses and cancer and other disability and death in adolescents. For example, we already have discussed about HPV. HPV, human papilloma virus vaccine, protects the females from cervical cancer and also other types of non-cervical cancer in males. Madam also, Kalyani ma'am, very beautifully explained all the vaccinations. She also mentioned about hepatitis A and hepatitis B, which are hepatitis B can protect the teenagers. Yes, hepatitis B can protect the teenagers. Okay. Okay.
I think someone's.
Yeah.
Hello? Is it Sneha?
You can unmute and speak.
Okay, thank you, sir. Thank you. So, if we take examples, as I said, for cancer prevention, there are vaccines like HPV and hepatitis B vaccine. HPV protects from cervical cancer in females and other non-cervical cancers, as I mentioned, like oropharyngeal cancer, penile cancer, anal cancer in males. So, that is one example. Hepatitis B vaccine, which protects from hepatocellular carcinoma. Then, apart from cancer, also many chronic illnesses like chronic liver disease, renal disease. Then, as Madam also mentioned about pneumococcal vaccine, which protects from invasive pneumococcal. She mentioned also about meningococcal. So, vaccination is a modality which can prevent you from cancer and other ailments. It can provide you long-term protection, and we also have to understand certain realities. First of all, uh, HPV and Tdap. They are basically the true adolescent vaccine. These two. Considering HPV, when we see there is robust data, cervical cancer is one of the fourth most common cancer in women, and it is mostly caused by serotype 16 and 18. So the cervical cancer vaccine, which is there, basically in India, the quadrivalent vaccine, which has covering four serotypes, and there is also a 9-valent vaccine covering 9 serotypes. Studies have shown that the quadrivalent vaccine can protect from cancer by 90%, and the 9-valent vaccine has a penetration rate of 95 to even 98%, which is astonishing. So taking the vaccine will protect you from the disease. Similarly, if we see oropharyngeal cancer, such a common scenario we see, lot of males in 2020 in India, there were more than 17,000 cases in males and more than 3,000 cases in females. We see when we talk about anal cancer, the prevalence is very high. The prevalence is around in homosexual males, the prevalence is around 95%. The recent data shows in India there were more than 3,000 cases of anal cancer. Penile cancer similarly has more than 10,000 cases. Hepatic cancer is quite prevalent in India. So, considering the adolescents, their habits, because as we mentioned, right from the preconception we were discussing, and Prashant sir also mentioned that adolescents get indulged into a lot of habits: drugs, junk food, cigarette smoking, tobacco consumption. So these things decrease the immunity and make them predisposed to conditions. Similarly, the teenagers or the adolescents, like you mentioned, who are already suffering, like from hematological conditions or people who have asplenia, who are immunocompromised. So the madam was also mentioning that these cases, these subset of adolescents or these subset of population is very much prone to be affected by capsulated organisms. So there the vaccines which protect us from capsulated organisms like meningococcal vaccine, pneumococcal vaccine, typhoid vaccine. So definitely it is a no-brainer that taking vaccine in adolescents will prevent us from many diseases. We were the government of India, IAP, they were not fools that we again introduced adult BCG vaccination. What was the need? Even American Academy of Pediatrics has done a lot of research along with CDC that BCG vaccine, the BCG is itself used now to treat early stages of bladder cancer. This is now on a very early stage. So this is now a very big domain. Vaccine is the best modality to protect us from cancer and other chronic illnesses. It imparts herd immunity. It not only benefits us, but also benefits others. So definitely vaccines is a sure shot when it comes to protection of adolescents from cancer and chronic illnesses.
Dr. C.
Thank
Salam,
you.
time.
Yeah, I think we should conclude in another 2 minutes to finish it off.
Yeah.
Dr. Pavan.
Yeah, thank you, sir. Thanks for your taking time for this valuable information. And we are very clear with this, your information, what I have given to all of us. We are so thankful to you. And my next question is for Ram Bharat, sir.
Yes.
Sir, my question is about how can schools and colleges plays a role in promoting vaccination among the teenagers?
Yes, school and colleges are important place because just now we had heard in last panel discussion that that these teens are very close to parents and then teachers. So teachers must be involved in promoting these adolescents for taking vaccinations. Also, certain pediatricians and adolescent consultants and social workers should take some programs in college regarding awareness of these vaccines.
Yes, if I okay, if I can add a little bit to this.
Shall we
Yes.
conclude, Pavan, because I think time is running short, Dr. Pratik. Sorry about that.
Okay, okay, yeah.
Okay.
Yeah, time is running out, so we can conclude with our session with our very warm regards and thanks for giving me this golden opportunity among you. I speak among you as a great persons. I'm so blessed to have in this webinar, and thank you Himamindu ma'am, and thank you rest of the all dignitaries who are present here. And thank you, Himavindu ma'am, for giving a golden opportunity to me
Great. Thank you.
in
Yeah,
IIP
I think
Academy.
thank you, Pavan, for moderating it very nicely, and I hope and also would like to thank panelists for covering and giving youth members as well as us a very clear and crisp messages about the vaccination. So we move
Thank
on
you,
to our
ma'am.
next. Fine. We move on to our next session, which is by Dr. Shubhangi Thakur. She is a dentist by profession and identified by UNICEF as a youth advocate. And I would like to invite Dr. Shubhangi Thakur for sharing her experience on adolescent immunization. So please, Dr. Shubhangi.
Good evening, everyone. I have learned so just listening in, and it's a privilege to be a part of this space where such rich perspectives are being shared. I am Shubhangi. I'm a public health researcher, policy advocate, and a youth leader with academic training in dentistry. As a Yuva UNICEF youth leader, I've had the opportunity to be a part of national consultations on adolescent health and mental well-being previously. And these experiences have made one thing very clear to me, which is that when young people are included meaningfully in the design and delivery of health programs, outcomes are more inclusive, responsive, and effective. But today, I speak to you not just as a young health professional, but also as a young woman, a peer, and somebody who firmly believes that adolescent health is nation building and immunization is one of its strongest foundation. As you all know, and from the discussion that we have previously, we know that India has a vast immunization footprint and it continues to be a global leader. But adolescent specific vaccination still doesn't feature as prominently in our universal immunization program. The Indian Academy of Pediatrics, in that case, has come in clutch, recommending key vaccines for adolescents like HPV, Tdap, as listed by Dr. Kalyani, and others like MMR, hepatitis B, typhoid, and other as catch-up options. But through my work with young people, I've come to realize that these recommendations often don't reach the ground. These vaccines aren't very widely known, not even among parents or caregivers who are otherwise, very deeply involved in their children's well-being. HPV in particular opens up as an important conversation and not just about cancer prevention, but how we view adolescent health more broadly. When we talk about HPV, I think we're also making the case for a stronger, more structured approach to adolescent vaccination as a whole. And more importantly, I think we're beginning to bridge this crucial gap between adolescent health and preconception care, which we talked about in the last panel. Because preparing for healthy adulthood doesn't begin at 21 or 25 or whatever number you want to give it. It begins with what we know and what we access when it comes to adolescence. Preconception care, as again we talked about previously, is often framed as a women's issue which is closer to pregnancy, but I think its roots lies in the physical, emotional, and reproductive health choices that we make very early on, like literally in our adolescence, as soon as we turn teenagers. And vaccines like HPV are a part of that particular foundation. And so are the conversations around, nutrition, menstruation, mental well-being, and also safe and healthy relationships with our peers. That's why spaces like these, where we get to share our research, experiences, insights, are very important because they help us connect the dots, learn from each other, and bring these conversations to young people in ways that actually resonate. I also strongly believe that, vaccines are the most transformative public health tools that we have today. COVID-19 only reinforced this truth. It showed us that timely vaccination can save lives, stabilize entire nations. So, as we think about building resilient health systems, adolescent health and vaccination deserves a stronger place at this table. My journey with HPV awareness began when I was in dental school, probably second year, I think, and which was during when I was studying oral cancers. And it struck me how this one virus, human papilloma virus, which has like more than 100 strains, could be linked not just to head and neck cancers, but to cervical, anal, penile, and oropharyngeal cancers. I was so fascinated by it. And as I moved into public health, I began to see the deeper gendered layer of this issue. Theoretically, cervical cancer is preventable. Yet, because of lack of information, access, or awareness, you name it, girls often don't get vaccinated in time for a totally preventable cancer. In my work with adolescent girls, especially through the workshops that I take for SRHR and body literacy, I've seen firsthand how young people engage, when we give them the space. When I explain what the HPV vaccine does, not just in terms of health, but in securing their future, the response is powerful. They ask smart, honest questions. They want to protect themselves. So, in my view, what's missing is not interest, but it's structured awareness and access on the ground. Even last year, when I was conducting this cross sectional research study to understand parental awareness and parental attitudes towards the HPV vaccine, which is yet to be rolled out but will soon roll out by the government in a couple of months, I learned how so many parents are open to vaccination once they have the right information. The only barriers that I could gauge through conversation and through that research was cost, limited outreach, and concerns which were rooted in cultural taboos, given the cultural landscape of India. I also learned that parents and especially mothers are powerful allies in this conversation. When they feel informed, included, confident, and reassured, they become the best champions for their children's health. So, today, to everyone here, fellow youth, pediatricians, public health leaders, let's ensure that we make adolescent vaccine a priority and not just a footnote. Because, and also, if you're talking about HPV, let's engage boys as well, because it's quote unquote not just a girls issue. And same goes for preconception care, as has been voiced by so many of us earlier here. This isn't only about girls. It's about creating healthy futures for all the young people, regardless of gender. It's about equipping both boys and both girls with the knowledge, tools, information, and support to make informed choices long before parenthood comes into the horizon. Because, yeah, I mean, just building a next generation, healthier next generation begins with preparing both halves of it. Thank you.
Thank you, Dr. Shubhangi, very nicely. But see, the AHA and pediatricians have come forward for this vaccination thing. But the important, with conviction, what you are saying and how you are, advocating this, I'm sure that it will do wonders. So we would like to have you in our programs for advocating, especially on adolescent vaccination. So really nice to hear you. Yeah,
To
sure,
add,
ma'am.
Smita, just to add, I want to just appreciate Sumangi myself, and want to say that AHA is committed to promote HPV vaccination, and we had already made a promise and a commitment, in the Pedicon, Hyderabad, and we have released consensus guidelines on HPV vaccine, which is on our website, and we will take it up along with UNICEF and all those who are supporting HPV vaccines. And we are outreaching through our cascading program called Empower Yuva, where vaccination is also one of the priorities. So we'll be creating awareness around this in all schools and colleges.
Yeah.
Thank you.
That's so great. Yeah, I wish all the best to
I
the
invite
entire
you to our AHA Youth Forum, and please be our ambassador too.
Thank you so much.
Thank you, ma'am. So before we move on to our next session, but I would like to hear one or two more youth voices if they are around. I could see Mr. Lav Kumar Singh or Zonam Sangama or any other if I have not known. Would you like to come forward and say, how did you find this talk? Would you like to share your comments? Any youth members, youth champions? I can see Nomika also there. She has been, advocated for NCDs and diabetes in the last series. So please come forward. I would request you to come.
Yeah, so maybe I can speak only
Yeah, please.
some like I'm not gonna take much of the time. So
Okay, I know.
yeah,
Yeah.
so I got to know that preconception care through a lot of doctors that are present earlier, like Dr. Shupangi said that it was just a woman issue. But today it's not just a woman's issue. It is rather an issue of both men, women, as well as transgenders, which is, I guess, often underlooked, misunderstood. And it's not just about pregnancy, it's way before that. And it includes nutrition, mental health, across both rural strata and urban strata, tier 1, tier 2, tier 3 cities in India, STDI prevention, like we talked about, and teenage pregnancies, chronic disease screening, especially for those youths living with NCDs like me. There are tools that could empower a lot of people, especially those that are living with NCDs, to make informed choices. And moreover, apart from women, men and boys also play a vital role in this thing. Just as one of the moderator of our panelist was, whether as partners, peers, future, fathers, and anybody who can educate us, and they can also influence the decisions and cultural attitudes. Because still being a person from Punjab, we have a lot of cultural taboos right there. Vaccinations, a lot of people are not considering that, and vaccination, that is HPV, don't even know that it can save and prevent you from cervical cancer. True health and equity, I think that it starts when everybody is informed and involved in that, even the family members. And early intervention at school, and informing the parents, informing the primary caregivers or secondary caregivers through vaccines, education, can shift the narrative from being a completely ill person at a later stage of life to being like we say that it's better being safe than sorry. And thus, rather than taking so much amount of money at the and experiencing the midlife crisis, we can definitely educate the young people as passive recipients of care and also the family. And I feel that we are the present, the future of tomorrow, and the preconception care and vaccinations are more like, for our self respect, responsibility, empowerment, and not only just for ourselves, a lot of people around us also. So it's time to, I guess, break the silence and, remove the stigma, helping also. Like, we are the educated strata, I understand that. But what if we can get involved with the rural strata and make adolescent health a priority by clubbing up with UNICEF for all the genders everywhere across all the, I feel the states. I hope I did not say too long.
Yeah, that's fine. So that is what we need actually. We need people like you, Dr. Shubhangi, and our youth members like Samira, Pavan, and other members to come forward and then, take care of your health and also help others of your age to have a good health. So anyone else would like to come forward, please? Okay, so anyone?
Yes, ma'am.
Pavan?
By
Yeah.
joining this session, I have learned many health related matter and information related health. Being a technical student, we will not care about much about our health. Why? Because we are not awareness and we are not we are not apart from that. No, by conducting these sessions, we are much activate by listening these sessions, and we self will promote. These sessions has been conducted by this IAP Indian Health Academy. I'm so blessed to join this session, ma'am. And I thanks to all the doctors who has given a much information than required to us.
So thank you, Pavan. So look forward to have, further your involvement in further programs also.
Yes,
So
thank
now
you,
I
ma'am.
would like to hand over to Dr. Samisha, who is a very dynamic personality and as well as I would say the backbone of this program, who is working hard at the back to, help us, to guide us. So I would like to invite Dr. Samisha for the quiz program as well as the, digital work, which are certificates, to give certificates to our panelists of our, sorry, youth members. So Dr. Samir, please.
So dear friends, really a good evening and excellent program was going on. And we have to conclude the program anyhow because it's a too lengthy program will not help us for the continuously stakeholding the people who are really interested. And for that purpose, we are concluding the program. And I really sincerely thanks the AHF first and Dr. Hima Bindu madam for this giving this concept of involving the youth in the each and every program. And today it's a time to felicitate each and every youth who is really involved since last two programs of the our Wave 18 and the March 18 and the April 18. And for that, we are providing the appreciation certificate to them. First of all, that I just giving to Mr. Pavan Kumar for this participation of this and excellently moderating the panel discussion on the vaccination. Again to Sneha Samira for this one more panel of the very untouched topic of that preconceptional care. And of course, Shubhangini Thakur for her experience about the setting up the how HPV vaccine and that how we can promote it in a proper systematic way to involve the more and more youth. Of course, we should not forget our last three youth who has also taken involvement in the our March 18 episodes, and for that I giving the certificate of appreciation to the Nomika Khanna, then Venkat Kalyan and Miss Prujna. All three has really excellently did the panel discussion in last month, that in the 18th of the March, and many more March 18th this year coming with the more and more youth involvement. So this is all about the certificate giving, and now it is a time to about the IAP AHA Wave 18 quiz, and I am sure many of you will really interested to read what is the result of the last quiz. So before I announce the quiz result, this is the basic instruction for the all the youth who is really want to attempt this quiz regular base, that the age of the participation of the quiz is 13 to 21 years. Quiz will remain open for the next 7 days after its launch, and 75% marks is required to get a participation certificate. Single attempt will be allowed, and all the questions are compulsory, but there is no negative marking, so you can directly mark whatever the youth got. Winner and runner-up will be announced in the next month of the 18th on the basis of the highest mark and earliest attempt. And only first attempt will be considered for the winner and runners-up. And most important thing is if you are not will be the winner or runner-up the any of the quiz, but you will still get the chance to participate in the final mega quiz in the Adolescent in the Ahmedabad in September between 19 to 21st. And for that, you have to consistently participate in the 6 quizzes that going to come till the September month. So please continue the attempt whether you will get the highest mark or not in this quiz. So what's about the first quiz, that is on the youth wellness and fitness quiz, and we having almost 358 responses were there between the age group of 13 to 21st, and this is the average age group that what we are getting the results of mean age of the 18. And these are the questions that will be usually missed by the many of the things, but they are getting the answer immediately once they are attempted. So please get updated yourself about this answer. This is the age groups where they are what we are maximally getting the response. And of course, the male-female ratio is again the female is the 41.1% and male attempted at 58.9%. And the college and school ratio that include the again 95.5%, that is school going students who were really participated in this event. So let's announce the result of the quiz 1, and what I have to see that almost that the winner getting out 25 questions right out of the 25 questions what we had attempted. So it's a really a great achievement of the 3 winners. They are getting the highest mark of the 25 with a good attempt. That included Yusika Manchanda from the Haryana, Rudraksh Bansal from Delhi, and Yukti Saini from Delhi. So heartiest congratulations to all the 3, and they are really get the winner certificate of the participation. Yusika Manchanda, then Rudraksh Bansal, and Yukti Saini. And you, of course, will get this certificate, a digital copy very soon to your email. And all the participants who is really participating will get this type of the certificate regularly if they are winner. Of course, the participation certificate immediately reaching to you once you attempted and getting the 75% or more marks. So now it's time to release the quiz 2, and that will remain open till the 25th of the April of this month, next 7 days. I already shared the link of that quiz, and this is a QR code that we are going to circulate in the different group. Please attempt this in a maximum way and get that chance of getting certificate. And of course, upcoming we can planning for some exciting prizes also. So my sincere thanks to each and every youth who are really working, practically doing hard to attempt. They will get the good work certificate and participation in the chance in the mega quiz. And all the question that we had planned is really covered well in today's webinar by our expert faculty. So who had attempted this in a sincere way, attended this webinar, will definitely give the answer maximum. Thanks once again, and hand over to the Sunita ma'am again. And my sincere thanks to Dr. Sri Sailam for all the painstaking for that all these quiz questions also along with the Dr. Sunita madam and Dr. Pradeep Kumar for making this quiz practically possible. Thank you.
So thank you, Dr. Sami, for it's really I appreciate your hard work, which is always done at the back, and at the same time, congratulations to the winner, and we look forward to active participation by them again. So coming on to the next session, which is a very important skit by Dr. Rashmi Gupta. skit which has been compiled by Dr. Rashmi Gupta. She is a senior pediatrician from Gwalior and hold various posts, especially the executive board post in Central AHA. So, Dr. Shri Shilam, I think Vivek is going to play the skit. I'm not sure. Vivek, hello?
Rashmi ma'am, मैं also do.
हाँ जी, Dr. Sameer क्या?
रश्मि मैडम भी कर सकते हैं.
समीर सर आप कर दो. You want to play it?
Just,
Can I
have
see
to-
it? I'm sorry to interrupt.
No, please, ma'am. Yeah.
I just wanted to thank Dr. Hima Bindu ma'am for giving me this opportunity. Secondly, I just wanted to say that this skit is made by the youth only, the choreographer, the cameraman, and the artist. They are all youth. So this is a bunch of a youth voice, but in Hindi. I hope everyone will understand. I hope it. I hope
Amazing.
it's a Hindi, but it's a youth voice. Whole thing is a youth voice. Thank you.
Amazing, Rashmi ji. Good effort. Thank you so much.
Thank you, madam. It's your platform.
Ours.
Yeah, ours. Let us play.
Who's playing it?
You can make Dr. Rashmi as the host if she has the video.
I have the video, but I'll see if it is on my laptop. I'll have to see it, check it.
मैडम आपने किसको भेजा ना?
मैं शेयर करता हूँ.
विवेक जी को
नहीं तो
Madam,
समीर
I'm
सर
playing
समीर
it.
सर
I'm
आप
sharing it, madam. I'm sharing it.
Vivek, please do it.
better because I'll have to search all over. I had
विवेक द कर रहा है. मैडम विवेक कर रहा है. Don't worry.
No problem. No problem, madam. Dr. Sameer.
Yes, Vivek.
Playing it, sir. Wait.
Yeah.
Meantime, I would like to say, Sameer ji, we also have to give appreciation certificates to all the pediatricians who are doing field work. Subsequently, after this, please also consider giving.
Definitely, ma'am. We can plan the first prize also for them. Doing the maximum field work. विवेक प्रॉब्लम हो रहा है तो छोड़ दो. मैं करता हूँ.
समीर जी आप लेके कर दीजिए ना.
लेके दो. He has already shared the screen. That's a problem.
Yeah. Because you were doing all that till now, certificate and all that.
Dr. Sameer was a great help.
Are you able to hear that?
Yeah. Please go ahead. Yeah.
Namaskar. This is Dr. Hima Bindu Singh, Chairperson of the Adolescent Health Academy for this year. And we are the biggest subchapters of the biggest organization of the pediatricians in India, that is Indian Academy of Pediatrics. Under the AHA, we are celebrating the Silver Jubilee year, and we have an action plan to empower Yuva. Our youth are the biggest asset for the country. They are 40% of the population, and we need to see that they are healthy. And our youth, when they become young adults, it is the need to teach them or talk to them about preconception care. So we would call this as the right start for life. So before we conceive our children, it is important that we prepare and nurture and make ourselves ready. So the girls and the boys, the young adults, both men and women, we need to prepare at least 4 months before and make ourselves healthy, become metabolic, have a good lifestyle. And if we have any bad obstetric history, we need to consult the gynecologist and make our things right. We need to take micronutrients, especially folic acid, take the vaccination, especially the MMR vaccine, so that we do not give congenital defects to our children. We also have to screen ourselves for genetic disorders so that we don't carry the genes which can transmit to the other next generation. We also need to take care of anemia, proper nutrition, be stress-free, and have a good lifestyle. And we also become metabolic is very, very important, especially the diabetes. And for the men too, there is a requirement that they also need to prepare themselves for the good quality sperms. They need to see that they also take micronutrients and be away from radiation. be stress-free, and have a good lifestyle. No substance abuse, not even a bit of alcohol is allowed this time, that is 4 months before the conception. So if you prepare well, that will be the best start for life, because we're creating lives. So I think we should spread this knowledge and empower young generation about the preconception care. So let's be part of this call for the best start in life. Thank you.
रिया, हाय बेटा। हाय रिया, कैसी हो तुम? तू क्या इतनी पतली और पीली हो गई है? मोहन और मेरी सास बहुत। ये क्या बताएगी? मैं बताती हूँ ना आपको। पूरे टाइम तो तला भुना खाती है, पूछो इससे। ऐसा बिहेव करते हैं। ये क्या हो गया मोहन को? ये तुम्हें मीता ऐसे इग्नोर करके क्यों गया?
ऐसी कोई बात नहीं हो रही।
मुझे एक बात बताओ, जब तुम 19 की थी तब तुम्हारी शादी हो गई थी और अभी मोहन की कोई इनकम भी नहीं है, तो तुम्हारी सास ऐसे क्यों चाहती है कि तुमको बच्चा अभी हो जाए? मीता, अभी तक तो तुम्हारी इंजीनियरिंग भी हो सकती थी और मोहन की MBA। मैं तुम्हारी जरूर मदद करूंगी। वैसे भी मैं आज तुमको इनवाइट करने आई थी कल रात 8 बजे ग्रैंड मदर पार्टी में। आपको भी कल मीता के साथ मेरी बर्थडे पार्टी में जरूर आ जाए।
बिल्कुल, मैं जरूर आऊंगा।
हाय मीता, थैंक यू।
लगता है बारिश होने वाली है, हमें निकलना चाहिए।
मीता, पता है कल हमारे यहाँ ना प्रीकंसेप्शनल केयर पर एक सेमिनार हुआ था। अच्छा, प्रेगनेंसी से पहले जो केयर की जाती है ना, उसके बारे में बताया जाता है इसमें। और मैं तुमको एक चीज दिखाती हूँ, ये देखो।
It is important because it prepares you financially and emotionally for for the upcoming parenthood, and also it is a way for a safe and healthy pregnancy.
मुझे तो ये वीडियो फेक लग रहा है।
नहीं, ये सच में मैंने अपने फोन से ही शूट किया है।
तुम्हें ये किसने बताया?
ये सेमिनार इंडियन एकेडमी ऑफ पीडियाट्रिक द्वारा कंडक्ट किया गया था।
हाँ, ये संस्था तो देश विदेश में भी मशहूर है।
और ये संस्था है ना, स्कूल्स में जाके बच्चों को वैक्सीनेशन और हेल्थ, इसका एक भाग AHA भी है।
AHA?
एडोलेसेंट हेल्थ एकेडमी।
वो सच में इससे फायदा होगा। ये प्लान तो हम भी कर रहे हैं।
रिया, क्या तुम हमें अच्छे डॉक्टर से मिलवा सकती हो?
हाँ, मैं तुम्हें एक अच्छे डॉक्टर से भी मिलवा सकती हूँ।
हे माता रानी, मैं दादी क्यों बोलूँगी?
छोटू, तू एक बार अपने भैया से बात करके देख, मेरी तो वो सुनता ही नहीं है।
माँ, मैं क्या कर सकता हूँ?
देवर जी, क्या हम डॉक्टर के पास चलें?
जी भाभी।
हेलो मैम, नमस्ते। मुझे आपके बारे में रिया ने बताया है।
हाँ, बताइए क्या प्रॉब्लम है? मैम की शादी को 1 साल हो गया, ये तो तक मान नहीं। आपकी उम्र 19 साल के हो और शादी को 1 ही साल हुआ है और इसमें 2 अबॉर्शन भी हो चुके हैं। मैंने भी शादी के बाद बहुत उम्मीद करती थी, 11 महीने के बाद मुझे भी बेटा हो। देखिए, प्रीकंसेप्शनल केयर बहुत इम्पोर्टेंट चीज है। इसमें क्या होता है कि हम तैयार करते हैं अपने शारीरिक रूप से, मानसिक रूप से और फाइनेंशियल रूप से गर्भ धारण के लिए, स्वस्थ गर्भावस्था में जाने के लिए तैयार। हम इनको भी पहले से ही समझ लें और हम पूर्ण रूप से एक अच्छी स्वस्थ माँ और जो एक अच्छे स्वस्थ बच्चे को जन्म दे, उसके लिए हम तैयार हैं। और ये कब करना है, ये आइडियली तो 1 साल पहले से ही हमें शुरू कर देना है।
इस बीच में मैं अपनी एमबीए की पढ़ाई भी पूरी कर लूंगा, अमिता भी अपनी इंजीनियरिंग कंप्लीट कर लेगी।
हाँ बिल्कुल हो सकता है ऐसा, बिल्कुल बिल्कुल। देखो कितने खुश हैं दोनों, बहुत अच्छी समझदार बहू चुनी है मेरे दोनों ने। मोहन,
हाँ माँ, बुलाया आपने?
बेटा कॉलेज जा रहे हो ना, इसको भी ले जाओ, इसकी भी बस नहीं आई अभी तक, इसको भी छोड़ के चली जाना है। लेके जाओ इसको।
बेस्ट ऑफ लक भैया अभी।
नमस्कार। ग्वालियर एएचए द्वारा गर्भधारण पूर्व देखभाल पर एक लघु फिल्म सही शुरुआत के विमोचन के इस शुभ अवसर पर मैं डॉक्टर सीपी बंसल, पूर्व आईएपी अध्यक्ष और एएचए चेयरपर्सन, अपनी शुभकामनाएं देना चाहता हूं। डॉक्टर रश्मि गुप्ता एवं उनकी टीम का समर्पण और नेतृत्व अत्यंत प्रशंसा के योग्य है। हर सफल कार्य के लिए दोस्तों तैयारी आवश्यक होती है। इसी प्रकार माता पिता बनने से पहले भी दंपत्ति को मानसिक, शारीरिक और आर्थिक रूप से तैयार होना अत्यंत आवश्यक है और इसी तैयारी को गर्भधारण पूर्व देखभाल कहते हैं। संतुलित आहार, नियमित व्यायाम और नशीले पदार्थों से बचाव जैसे स्वस्थ जीवन शैली को अपनाना गर्भधारण पूर्व देखभाल का हिस्सा है। यह देखभाल गर्भावस्था एवं शिशु जन्म को स्वस्थ और जोखिम रहित बनाने के साथ साथ माता पिता को मानसिक और आर्थिक रूप से सशक्त बनाती है। मेरी हार्दिक शुभकामनाएं डॉक्टर हिमा बिंदु सिंह को, जिन्होंने एएचए के सिल्वर जुबली वर्ष में युवा सशक्तिकरण को प्राथमिकता दी है। धन्यवाद।
And I just want to say that knowledge of preconceptional care should not be imparted only to the married couples, but also to those who are in late adolescent phase and young adults. The investment in preconceptional health is going to have a positive impact on country's future too. To begin a super generation, preconceptional care is the right start. सही समय पे सही जिंदगी की सही शुरुआत हो तो बहुत ही अच्छा है। और अंत में मैं अपनी क्रू मेंबर्स का भी धन्यवाद देना चाहूंगी क्योंकि उन्होंने मन से हमारा साथ दिया। थैंक्स। नमस्ते।
Thank you, Dr. Rashmi. Very nicely script writing and direction that you could lead the youth people, to give this message along with, of course, a message which has been, came across with such a conviction by Dr. Hima Bindu ma'am and Dr. C.P. Bansal sir. So hope we will be able to convey this message to our youth members as well as our pediatricians. So next is, as we know, time is always has been a constraint. I would like to invite Dr. Smita Mishra ma'am to please tell more about the song and her efforts as she always been doing, but would love to hear from you. Please ma'am. Dr. Smita ma'am.
Hello. Thank you so much for giving me this chance. This song is, I think, summary of the whole whatever we have learned just now. So I think you can play the song and video just now. Thank you so much.
Thank you, ma'am.
Yeah. Healthy youth, healthy nation. AHA calls for risk prevention. Prevention is better than cure. Youngsters must be safe for sure. 1, 2, 3, 4, 4, 4. Tetanus, the deep typhoid, rubella, hep A, B. If was not done before. Flu vaccine, 2 risky ones. Yeah. Oh, adolescents, reaching your 14. Be smart and enjoy your teen, but never forget to get HPV vaccines. Tika lagale, Stay safe from cancers and bad infections. Prevention is better than cure. Happy life, rest assured. La 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 la. Hey, hey, hey. Oh, young girls and boys, health is wealth, so enjoy. La 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 la. Prevention is better than cure. Adolescent, be safe then explore. Fun, game, fun, la 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 la. All adolescents, girls and boys, life is fun, explore the joy. But have safe sex, safe experience. Say no to violence. Be tolerant, hey, 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 hey. Safe driving and no drunk driving. No cocaine, alcohol smoking. La 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 la. Have a healthy diet. Happy BMI, no tension, no metabolic syndrome, depression. Raw fruits, vegetables, protein, low carb, more greens, exercise, yoga, adequate sleep, keep peace, no screen time. Hey, 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 healthy adolescents are treasure, a ray of hope for future. Happy youth, happy nation. Prevention is better than cure. Sure, let's ensure. Happy youth, happy nation. AHA calls for action. Smile, laugh, and have fun. Prevention is better than cure.
Wow.
Thank you so much. Thank you so much. And basically, this song is about that life is definitely for enjoyment. Always find happiness wherever, but always think about yourself, what is good for you. So that is risk-taking behavior is actually not very much recommended. And this is what is this song is all about. Thank you so much.
So thank you, ma'am.
Wonderful, wonderful.
Wonderful,
Thank
of
you.
course.
Thank you, ma'am.
And this song
Thank
is energizing us to take care of ourselves as well as our youth. So energy is, flowing everywhere. So with all of this, well, I mean, it has been a great session. I would thank everyone to be a part of it and would hand over to Dr. Prakash Veeraria, sorry, for a formal thank you and concluding the today's session. So Dr. Arya sir.
Before Arya says formal thanks, I would like to appreciate all of you, Sunita, all of you have done so well organized, and thank the UNICEF team headed by Ali and Salima, all of them, Aditya, for coming over. I am seeing a lot of long way to go and a lot of collaboration can happen. Youth icons, they were so good. And C. Salem, Samisha, all the team, Smita Mishra, it was like icing, such a nice song. And let us now make this viral. Let us give to all our pediatricians all this material, the PPTs with the banner, with all the song. And I request all our colleagues to do some activities in the colleges, universities on this preconception care and vaccination, so that we really can, that will make some impact, some change. Okay, thank you. Over to you.
मैडम इतना अच्छा प्रोग्राम और इतनी अच्छी कंडक्शन के बाद और अब थैंक यू बोलने का समय है। आपने बहुत अच्छी तरह से आपको सबका तो थैंक यू बोल दिया, फिर भी मैं फॉर्मल थैंक यू बोलता हूँ जिन जिन लोगों ने इसको प्रोग्राम में पार्टिसिपेट किया, इसको सफल बनाया, सबको दिल से धन्यवाद देते हैं। सबने जिन्होंने पार्टिसिपेट किया सबको धन्यवाद, और ऐसे ही हम लोग एडोलेसेंट के लिए कार्य करते रहें। थैंक यू फॉर अटेंडिंग दिस प्रोग्राम। थैंक यू।
आपके थैंक यू से प्रोग्राम की शोभा भी बढ़ गई ना सर, इसलिए आपका थैंक यू करना अच्छा था। एनीवे, ठीक है सर, एनीथिंग?
Sunita ma'am, if you could allow me just 2 minutes.
Yeah, Dr. Pratik, yeah, please say.
Ma'am, just 2 lines I want to say.
Yeah,
yes. First of all, it was such a beautiful and engaging session. I am thankful to everyone, especially Hima Bindu ma'am, for choosing me, giving me an opportunity. प्रकाश सर, एक बात याद आ गई जब आपने ये बात बोला. आई हैव बीन सीइंग यू पीपल, आई हैव बीन सीइंग दिस ग्रुप. कुछ दिनों पहले आई वाज टॉकिंग विद द ट्रेजरर अतनु भद्र सर, and we were talking about all the chapters of IAP. So in a conversation came, a line came that IAP is a big galaxy having multiple galaxy of stars, and each galaxy of star is a chapter. So it is a galaxy of many chapters and sub-chapter. But I can definitely say that AHA chapter is surely, in Odia we say the Dhruvatara, the pole star.
Wow.
The way you people are working,
Dhruvatara.
I mean, it's complete fluidity. Everybody is so passionate across ages, across positions, keeping aside all the ego. Everybody is working hand in hand. And that itself speaks volumes about the bright future AHA is showing to trying to portray. Another thing, ma'am, to Hima Bindu ma'am and all the senior think tank, I have shared a PDF regarding the adolescent immunization guide, which is prepared by American Academy of Pediatrics. If madam, we can prepare something on the similar lines, you see such beautiful and in such a lucid way they have presented, so that it contains the dosing schedules presented very beautifully by simple diagrams and flowchart, and also contains many FAQs. And thanks to Shri sir also, that उन्होंने बिल्कुल अच्छे से पकड़ा था what kind of questions are to be framed over here. We could have framed many scientific and analytical questions which would have only confused our youth volunteers. But the way the questions were framed, they were so practical and such befitting to the society in general. I mean, hats off to Team AHA. And I request if we can also prepare something like that in similar lines, so that we can propagate that across institutions.
Yeah, thanks,
Thank you,
Dr.
ma'am.
Pratik. I think Dr. Mohapatra wants to say something.
Dr.
Madam,
Pratik,
I would
like
to say that whatever your according to the American guidelines was, please share the PDF here also so that everyone can get access to it.
I already have shared.
Where?
Nomika ma'am, I have already shared.
No, I want to say,
In
Dr.
the WhatsApp,
all of
in the
you,
WhatsApp, I have shared the
Oh,
PDF.
yeah, okay, in the WhatsApp.
Yes.
we'll be adding this in our vaccination module, Pratik. We'll take it up. We
Thank
are
you, ma'am.
preparing
Thank
for
you.
Dr.
vaccination
Mohapatra,
module.
sir. Yeah, please.
Madam, this is amazing session actually. But I want to propose AHA to have a word with Government of India, because now another pediatrician, Shobna Gupta, is in charge of Deputy Commissioner Child Health and RBS Care KSK. She is conducting these monthly webinar for different topics. And if this will be incorporated in that platform, I think whole of the country, and it will reach to the last mile of the people, those who are working in the field. So it will be a lesson for the team who are working for adolescents, and again it can reach the adolescent in the last mile also. So I will request Hima Bindu madam to explore
We'll
that
take it up,
opportunity.
Dr. Aditya. We'll take it up.
Yeah.
And Dr. Salima also wants to say something. So last comment, and Dr. Sameer also. So please just
Thank you. And I wanted so much. Yeah, I'll take a minute. On behalf of UNICEF, I wanted to thank Dr. Aditya and Dr. Himabindu and the entire team of IAP AHA for, such an amazing webinar, especially thanking the youth advocates. We had some amazing voices, and we look forward to taking this on a month-on-month basis and improving it as in every month as we go forward. Thank you.
So final remarks by Dr. Sameer. Yeah, please, Dr. Arya sir.
हाँ, बहुत अच्छा प्रोग्राम. इवन फॉर्मल थैंक यू के बाद भी सबको है ना जाने की किसी की इच्छा नहीं हो रही. इससे अच्छा प्रोग्राम नहीं हो सकता मैडम.
सही बात है. Dr. Sameer, please.
Sameer sir.
My comment on
Unstoppable.
that.
Thank you.
My comment is related to the Dr. Pratik Kumar's comment.
Yes,
We
sir.
already our adolescent vaccination card is there with a few important guidelines and the schedule that is required for our Indian adolescents, that we are already published and released already in the last year only in the adolescent.
Okay,
Dr. Sameer, Dr. Sameer, just a minute. You are surprised for all of you. I was traveling and I landed at Geeta madam's house. See, she's Geeta Patil here. Okay, Dr. Sameer, I am sitting with madam only.
So
Hello, ma'am.
I think I was listening
Last
to
and
Hima
final
madam.
words from you.
Yeah. Okay. I think I have not heard entire program, but whatever is going on is really commendable, and we should do it. AHA requires to take it forward, all these whatever agenda we are doing, and all our adolescent ambassadors are here who are so passionate about their work. I'm seeing everyone here, and that's a great thing. Thank you very much for giving me opportunity.
Yeah, our immediate past year person who has showed me the way how to work in AHA. Thank you.
Thank you.
Okay, thank
very
you
much,
all
all
for
of you.
attending. So bye for today.
Bye-bye.
So,
Bye.
bye.
Bye-bye.
And Dr. Sunita, wonderful conduction of the program. I
Right.
think you need the best.
Thank you, Dr. Smita.
Yeah.
Thank you. Thank you.
Okay.